Okay, I think in the interest of time, let's start our meeting. We do have two very engaging speakers with us today. So welcome everybody to our October Zoonotic Disease Action Package meeting. I believe I know everybody on the call, but just a quick reminder, I'm Kat McGillicuddy. I'm part of the UK's Health Security Agency, and along with Silas Whiteley from our Department of Environment, Food and Rural Affairs, we're the co-chairs, the UK co-chairs of ZDAP for this year. As I just stated, we are recording this meeting for inclusivity purposes. So we do make this recording available to our ZDAP members who cannot join at this time due to significant time zone clashes. So I hope those who are watching this on record are having a good day so far. So we do have a really busy agenda today, thanks to our guest speakers. So we won't dwell on it too much. So you'll have me speaking just as our introductory section before we hand over to our guest speakers. And then Silas will pick up at the end of our meeting about preparations for our November/December ZDAP meeting. So we will be finishing within the hour. As a reminder, in ZDAP, we have a way of working to ensure that we are an inclusive, collaborative, and effective network. And we do this to ensure that this network is useful for everybody. So we ensure that, we would support everybody feeling they have an equal voice. They can feedback at any time during this meeting or afterwards. We are a partnership here. We are supporting each other to build capacity and capability. And we do want this to be useful. So if you have any feedback at all on this meeting or prior meetings or activities we do as part of ZDAP, please do not hesitate to contact us or the Secretariat. I'm going to pause now to let members, if they feel comfortable, to raise any situational awareness or instance or updates they'd like other ZDAP members to be aware of. From the UK, I will just say that a lot of us are quite heavily focused on preparations for the negotiations of the Pandemic Accord, WHO Pandemic Accord, where the UK has prioritised the inclusion of the One Health approach across the Accord. So we are working very hard preparing our negotiations on that. It's taking up a lot of our time. Silas, is there anything else you'd like to mention on behalf of the UK?
I don't think so this morning. Thanks, Kat.
Okay, well, I'm going to move on, but the chat function is open for those who wish to put in any links to reports or anything else into the chat function to share with others. That would be really appreciated. I think my last slide today is just a reminder how you can contact us, and that we will make sure we'll share all the available presentations as well as the recording of this meeting on our drive as soon as we can. I'm going to stop sharing my screen now. Now, this is where I wish Gina was here to make sure everything was in line, but we'll make sure it's okay. Okay, right. I am delighted to welcome the first of our two guest speakers to our meeting today. So Dr. Mursalin from the Pakistan One Health Alliance, it is an absolute pleasure to welcome you today to speak. If you would like to go ahead and share any slides you should have. Oh, fantastic, you're there already. And it would be really nice if you could introduce yourself and your organization to our community today too.
Yes, thank you very much. Am I audible?
You're perfectly audible, and I can see your slides, just not on presentation mode just yet.
Thank you very much. Thank you very much for giving us this opportunity. I think we are really pleased to share our experience and our work in Pakistan, because it was limited, but it was, you see, quite valuable from our point of view, you see. So Pak One Health Alliance is, you see, I would be talking about the One Health an event-based surveillance project, Pakistan, which was certainly supported by our partner ending pandemics. And there were a series of local partners, because you see, once you talk about One Health, you need to create partnerships, you see, with the other sectors, with other programs. It's not, you cannot have a solo flight in One Health. So Pak One Health Alliance was established in 2014, and as a local NGO. We have a good affiliation with multiple government, national, international organizations. We have a governing body and experts, and we are already partnering and have been working together with some of the regional partners like South Asian One Health Network, like the Asian e-Health Information Network. Like recently, we are partnering with the AMR platform, you see, which is a FAO initiative, and Wildlife Alliance, you see, and there are some other which we are partnering. And our priority areas of work is certainly One Health promotion, to work on emerging neglected diseases, biorisk management, pandemic surveillance. And luckily, we have done not much, but some work on in each of these areas that we am presenting. Zoonotic disease also, we worked on a vector-borne disease project and in the country, because you see the scale of the project is not very much, because Pakistan is a big country with a large population. So we had to be like doing pilots, working with the government on some areas. And this is the list of our partners. We are like having our memorandum of understanding, you see. Whatever we do in close collaboration with the government, just to have a good sustainable plan and just to get the ownership, because doing in isolation will not be that beneficial. Now coming to the One Health event-based surveillance project, because there are some other projects that we have already accomplished, but our today's talk would be on One Health event-based surveillance project. This project is you see, the main focus, the main idea behind this is to detect the epidemic disease earlier and verify those connects. So all these steps of epidemic management, you see, outbreak management has to be prompt. You see, have to be swift, have to take quick actions. Detection should be timely so that the verification could be managed timely. Then you see sharing of this information for an evidence generation, you see. So we, as part of this, we developed a platform, what we call as the One Health EBS platform. The crux of this project was twofold. One was certainly need to work for the promotion of One Health in the country in close collaboration with National Institute of Health, Ministry of Health, Departments of Health, and develop some guidelines, protocols, SOPs, and to develop some ICT solutions and for intersectoral collaboration and for timely detection and response. So there were two major functions. One was the One Health promotion guidelines, protocols, SOPs, and other was ICT solution. Coming to the One Health promotion, so we had so many activities we organized, like One Health mapping exercise, the gap analysis study, like who is doing what are the issues, problems. We develop a template on that. Then we also develop a curricula. You see, a curricula, two type of curricula. You see, one is a curricula, One Health event-based surveillance curricula for rapid trainings. You see, it's a quick training, short-term training, like 2-3 days, for the executives, for the managers who cannot spend much time. And then a longer-term 10 days curricula to be run in public health and animal health institutes and others, and for like 2 weeks or so. So this curricula was developed in close partnership with our partners and with the multiple sectors, like in animal and public health and in environment and food sectors. And then there are other number of, you see, capacity building workshops and the event-based surveillance manual that we developed and that was promoted and that was launched. And number of workshops that we organized. Training workshops were organized where the One Health promotion, One Health idea, One Health concept, the EBS, because EBS is a new concept. One Health, people have heard about One Health, but the EBS is not as much promoted in the country compared to the integrated indicator-based project. This particular project was launched in simultaneously initiated in other countries also, like in Albania, Pakistan itself, Bangladesh. I can see my friend Salim here, and Cambodia. So there were some variations from context from the country to country, but overall, you see the model was similar. Everyone was supposed to develop to start with a One Health platform, you see, One Health integrated dashboard and platform. So coming to the One Health dashboard, this was developed through a consultative process. And initially, because there are many sectors which you can call as the One Health sectors, but we thought that let's start from health and livestock, and let's fetch some very priority disease, 14 disease information to this standard information from multiple data sources, which are for various departments, because the departments or the ministries are running their own MIS systems for their own purpose and for their own use. It was the first time that we talked about, you see, bringing some of the information on a common platform. You see, coming to the, you already know that indicator-based surveillance is a regular data, routine data, and the event-based surveillance. So coming to the platform, coming to the dashboard, so we created two components of, you see, two parts of dashboard. One was dealing with the indicator-based surveillance, where the MIS systems of various departments, you see, they shared their information, some selected information, because all information we neither need as is not required. You see, for a One Health dashboard, we need priority, common type of information on which we can take some decisions. And the event-based surveillance. Now, indicator-based surveillance, you see, there are several MIS systems running in the department, especially in health and in animal health, you see, sectors. And this is the list, and they have some diseases which are common, and we can certainly take advantage of this. So initially, we selected some priority diseases which are common in these surveillance systems, and which could be, you see, we can fetch this information to a common platform. So this is the conceptual framework, and whereby the MIS units or the surveillance units of various departments were approached, and there were studies, and we you see, try to synchronize their list of diseases and you see, the indicators, and decided that what is to be collected and gathered and how the information would flow. And there was a, you see, some selected information was filtered out of these surveillance systems and was brought to the dashboard, and then some analytical component was added to it, so that the analyzed information could be shared with the program managers or with the, you see, the policymakers and planners. So the main audience of this system is certainly not everybody, not a general public or patient, but it is the policymakers, planners, managers who have to take common decisions. So this is the dashboard, and you can have a look at this. So there are data streams coming from multiple data sources and coming to, and there's a list of priority diseases, and these are the departments which are working together. Then each disease could be further analyzed, and you see, this information is shared, and this access is given to the planners, the program managers of various sectors. So coming to the event-based surveillance project, certainly there is a lot of information, disease-related information available on social media, on reporting, on newspapers, on electronic media, and several other data sources, which has to be also captured, you see, somehow. So that was not done before, because this was the very initial information. We were gathering information from the indicator base, and that was comparatively easier because that was formed, you see, already available. So in collaboration with the ending pandemics and medicines, we have come up with a dashboard where we can fetch information on daily basis from multiple data sources, from media, from newspapers, from electronic media, social media, and that comes to our, you see, this platform, and we can then combine it, we can compile it, and we can make analysis and make use of it. So all this, I mean, this work has already been showcased that on multiple forums, like for EHAN, like for Ohio University, and like for the One Health, you see the platform of One Health Commission. And so coming to the challenges, certainly the political commitment is very important, and that needs to be maintained, because this was something, the work we started, you see, for the first time. You see, there are One Health units, but certainly the One Health units or coordinating units have to get the support of multiple departments and organizations like One Health and others to really boost, because this is a big challenge. One Health is not as easy as it is expressed. So that was a real data sharing culture was not there. Devolution, there is a the departments, and you see the provincial, they are much devoluted. You see that they can take the provincial department and the federal department, they can take their own decisions. You see, that was a barrier for us, because we had to resolve that. As so disparity systems are not at the same pace. Public health surveillance systems are better in our country, for example. There is a MIS system or surveillance system for animal health, but it is still evolving, you see. But we did not find a good system for environment and food sectors. So this was disparities. You see, then issues relating data, dictionary definitions, reporting frequencies. So that is still, there's not that as smooth as we thought that we will be able to collate the things. You see, we need to first understand very deeply about how the systems are operating and what kind of information, what is the frequency getting. But good thing is that One Health application approach has recently been very amicably applied during the COVID pandemic time in Pakistan, also maybe in other countries. And also, for example, dengue and avian influenza. So this example or this similar project, similar work has already been done, which could be scaled up. So the next step that we would love to work, and we would be maybe working, is One Health operationalization, helping and working with the NIH, Ministry of Health, and other departments on this. You see, continuous work, because this is like a work in progress and a lot more has yet to be done. This is just, I think, the beginning that has been within the context, you see, and maintaining regular flow of real-time information from multiple sectors is important. And you see, converting this information for decision making. You see, the evidence-based decision making. This is an area to work. Ownership of our partners, of government, though government, you see, especially NIH, have been really supporting us in this context, because and they have really, I mean, given us a sustainability plan and said, but certainly much more is yet to be done, because this is a wider subject. And we feel that One Health EBS work is not is a continuous work, is like a work in progress. So this is a start we have made, and a lot is yet to be done, you see, in the context of our country, mother country. Thank you very much for your time and for this opportunity. Thank you.
Thank you. Thank you, Dr. Mursaleen. That was fascinating. And I think it will feed in very well to the next presentation from Dr. Daria as well. Dr. Wasif, I see you have your hand raised. Please do feel free to speak.
Thank you very much, Kat. Thank you so very much, Dr. Muslim, for such a wonderful presentation. I really appreciate the efforts of the POHA and all they have done. As Dr. Muslim said that National Institute of Health, they are more working toward the disease surveillance and response system on the human side, but now we are also planning to expand us toward the environmental sector and animal health sector. We had good meetings with Dr. Mussolini and we are collaborating with Dr. Mussolini. In fact, we want to incorporate that system in our IDSR. IDSR, Integrated Disease Surveillance and Response System, which we developed initially with the support of the UK HSA. And now we are expanding it. We have expanded to all the districts of Pakistan and we are working on it. So similarly, another effort for the One Health zoonotic disease surveillance, we linked with the Balochistan laboratory for the livestock, and now we are strengthening their laboratory and then we collect the data from that. That is another effort from the platform of the NIH. And definitely we will integrate the POHA, rather we are in process of integrating the POHA dashboard with our disease surveillance dashboard. And in future, we are looking toward more sustainability and more expansion toward what the Dr. Muslim work is done. And now we integrate it and progress it further. This was a short comment from my side and for the work of the NIH, which Dr. Muslim mentioned that he is doing with us with the NIH. So thank you very much once again for everyone and Dr. Muslim and Kat for giving us the Pakistan a platform to show the work which already done in Pakistan. Thank you.
Thank you, Dr. Wasif. Your comment is really appreciated. It's always lovely to see or to have the understanding of how individual projects are collaborating with government entities. And it's great to see the progress and the learning we can all take from Pakistan and what you're developing. Clara, please go ahead.
Hello, and hello, Dr. Mussolini. It was great to see Brooke as one of your partners there, organisation I work with. And I just had a quick question about that. You talked about shared decision-making being the next step. But have you seen, as a result of this data coming up, for example, animal health and human health sectors coming together to act? For example, an outbreak in animals that has triggered a joint intervention from the human and animal health sector.
Yeah, thank you very much. Can I answer? Mac? Okay, thank you. So thank you very much for this question. I think Brooks is a wonderful partner with us. You see, they are partnering in all our meetings, you see, and we take advantage of their work, you see. They're already doing good work in the animal health sector, and they have been partnering with us. So at this stage, I mean, they are partnering in the design of this dashboard, and they have been coming to our you see, events and giving us some suggestions. But at this stage, we are directly partnering for the animal health with the livestock department in Punjab, for example. You see, also we have a recent collaboration with the you see, the animal health commissioner in Islamabad. You see, the federal level. So that's why. But certainly, as I said, this is a work in progress. You see, we would love to you see, engage Brooks on that, and because they have a good background, you see, on that. And these two sectors are very critical to start with, you see. Certainly, we will involve. There's a lot of interest by environment and food sectors, you see, in our work. But you see, somebody has to steer the whole process as we go along. Thank you.
Thank you, Clara, and for the response. There's one further question in the chat that I hope Dr. Muslim, you wouldn't mind responding to in the chat from Dr. Salim, please. As I'm just very conscious of time, I do want to give our second speaker as long a time as possible. Please, everybody, continue to use the chat if you've got further questions for the Pakistan One Health Alliance. And now I'm going to pass over the floor to Dr. Fernanda Doria. Fernanda and I have worked together over the last 2 years on the project she's about to speak about. It's one I am very sillily enthusiastic about. So I'll try not to ask 100 questions of you, Fernanda, at the end of this presentation. So I'll pass over to you. So Fernanda, if you could please introduce yourself too as well, that would be great. Thank you.
Yes, thank you, Kat. And I am very conscious that either you could have delivered this presentation yourself. I see Tlala online. I don't know if you want to open your camera, who was also a part of this. I'm Fernanda Doria. I'm a veterinary epidemiologist, originally from Brazil, but home is now Sweden, where I'm working at the National Veterinary Institute, and I was part of this project representing FAO. And so it was a quadripartite initiative looking for opportunities for technical harmonization of their systems to strengthen One Health intelligence. So the project lasted a bit over a year, and it had several parallel activities: systematic literature review on One Health initiatives, 2 meetings with external advisory groups, a review of national best practices and competencies, an assessment of the quadripartite activities that contribute to One Health, and a characterization of risk landscape for specific agents, specific hazards, actually. The idea being, can we move towards a monitoring framework where we monitor drivers and consequences and not just disease? So that was the entire study. But because the promise today was that I was going to focus a bit on interoperability, then what I wanted to focus on is how we use the results of all those activities to build a framework of operational One Health intelligence. So the goal was to bring One Health intelligence to practice, deciding what that looks like, what's the framework that allows that to happen, how can we build that framework, and how do we go about, so build a blueprint, and then how can we follow that? So the first step was to break out what we're calling One Health intelligence. It's so broad, it's so big. So break it down into concrete, tangible goals. And in our case, we tried to break into preparedness and prevention, early warning, and risk assessments. And throughout the activities of this study, this scoping study, we realized that there is already a lot of activities within the quadripartite, but also with external collaborators that provide One Health intelligence. So the goal of building One Health is, of course, as everyone who has worked with it knows, is not of building anything from the beginning, but connecting all those cogwheels that already exist towards tangible results. So how do we use those cogwheels in an effective way to generate evidence? So the first step is, of course, to understand what are the components you have that can build that One Health intelligence. And the framework that was put forward by WOHI, but by this scoping study OHIS, is then using those building blocks to build applications, those applications serving specific purposes. I'll show that in a second. And then in between the existing activities and the uses you want to give to those activities, build an interoperability layer. So both from the informatics perspective, as well as from the operational perspective, what we need is to say, okay, we already do all these activities. How are we going to repurpose them to generate evidence for the specific goals of One Health intelligence? And what are the steps in between to connect those activities and repurpose their outputs? The way we go about this is case by case. So this is the kind of the wheel that we would be repeating several times. So it's not a linear work. You don't get there from as a line, you just get through iterating this wheel again and again and again. So the idea is that one activity at a time, you decide what is the specific use case, what is the specific operational case that we're trying to solve, what is one case where information can be shared across the One Health actors to produce better or earlier intelligence. And then do an operational inventory of what activities already exist that could contribute to that objective, and then implement the structure that you need to connect what already exists, whether that is connecting data, establishing interoperability of data, programming new applications. So what we would deliver here is small components that fit either on the data layer or the application layer to serve that one use case. But then we would sit, review priorities, pick the new use case, and start iteration again. The framework that is being built here in the middle is kind of an umbrella framework where all those little pieces would be available for reuse. The idea being, okay, in the next use case, maybe the applications we need, some components of it are already in the framework and you just reuse them. But maybe you need one more functionality. So you deliver that one more functionality. So it's, let's say it's modular in two senses. In one sense that you go use case by use case, but that's the operational part. But from the informatics part, it's modular in the sense that all the applications you build, they just live in this framework here in the middle as little modules that can be reused for the next use case. And although this is kind of a very bird's-eye view of the solution to interoperability we found, I didn't want to add a lot of details because I wasn't sure whether the interest would be more on the technical, operational side or the informatics side. So I'll be happy to leave some time for discussions and to answer questions according to what people are more interested in hearing. In identifying those use cases, what would be the use cases we could use to iterate? We went back to the goals we had established and tried to look for a use case of early warning, risk assessment, prevention and preparedness, understanding that those things are not done one at a time or sequentially. We can start with use cases in all those goals, and some may deliver on the short term, while others, especially prevention, may only deliver on the long term. But we can start multiple use cases at the same time with the focus of delivering concrete applications in each of those use cases. Sustainable applications, so by building a framework where the applications are shared, we can, for instance, share costs of maintenance or build the maintenance costs into the framework. Every time you build a new application, then you put some money aside for maintenance because it's really hard to get funding for maintenance. And focusing also in each use case to document the blueprint in a way that can be reusable at country level. So this project is looking into how to build One Health Intelligence at the quadripartite global level, but we hope that the frameworks that would be put forward could be reused at the country level. In all use cases, the identified priorities to bring in environmental health. So in every use case, besides trying to connect existing activities, we would also be brainstorming, trying to bring in the environmental perspective. This is just the One Health Intelligence scoping study just kind of reviewed what are the possibilities or the opportunities to do this and put forward this framework. It's not building it yet. For that, we need political will and financing, and the quadripartite continues seeking that. But even while we don't have a dedicated track for development of this framework, the quadripartite is already supporting the first use case identified, which was on early warning. So FAO, WHO, and WOA already had this joint global early warning system. And now we're bringing UNEP to attend that goal that I had talked about of bringing ecosystem health. So this is the idea that was put forward, is set up specific tangible goals, build the framework as specific models, both from the operational side as from the informatics side. And on that, I was really happy to see on the first talk how it was also discussed that there is an operational side to it and there is an informatics side to it. And so we are trying to think about both. And then develop this blueprint that countries can reuse at country level. As I said on the beginning, I stand here for a lot of people from all around the quadripartite that did this, including also the support from other partners. And as I said, Kat could deliver this talk just as well. Thank you for your attention, and I will paste the link to the final report of this study in the chat right now. Thank you.
Thank you, Fernanda. It's really nice to see, I think, having these two talks together, looking at what's been applied at a country level. And it's the same, I won't say challenges, I was about to say struggles, same challenges and difficulties being addressed at a country level and a global level. It can really show how we can learn from one each other as we develop these systems for quite a complex issue, is implementing One Health intelligence. So thank you for that. And thank you for posting the final report link. It was a labor of love, but you eventually managed to get it out there. Are there any questions for Fernanda from ZDAP this morning? Okay, well, I do have a question then, while others are thinking. So Fernanda, I know that Blues Plus has been investigated right now as to enhance its processes and develop it more in a One Health framework. Is there an idea of where it would go next if funding was available?
So we have written a concept note that talks about one use case for each of those wheels that I've showed. So the early warning is GLUS plus. The risk assessment would be just strengthening the way we do risk assessments together. Right now, we have protocols to do joint risk assessments also as part of the GLUS team. The GLUS team has also, and Itlala, please jump in anytime. You're way more experienced in the GLUS plus team than I am. But the GLUS plus team also has protocols for joint risk assessments between WHO, FAO, and WOA. And so we're bringing UNEP, the United Nations Environment Program, to understand how we can build upon their evidence, because of course the geographical scale and the time scale of the work they do is very different from the more event-based work we do. So understanding, maybe doing more risk landscaping work, how we can do risk assessments that actually take into account all the environmental data. And then the third is on prevention and preparedness. And there, I think it's more clear how we're going to have to focus on drivers, and therefore the goal of the role of environmental data is a bit more clear. It's just much more challenging to actually implement in practice, not just the knowledge to build those kind of models, but also the infrastructure to build those kind of models. And that's why it's more on the long term, and it's one that I think there is different initiatives going on. So the cogwheels of that are more spread. There's things going on, but I think putting it together in a framework of really doing it at the quadripartite level will require that financing and specific dedication of a few people.
Thank you, Fernanda. I can Itlala's camera and mic aren't operational today, so she will be able to answer any questions within the chat if anybody wants to direct any questions specifically to WOA about this project. Oh, well, says that was well covered anyway, so thanks, Itlala. There's a question here from our colleague in the Pakistan One Health Alliance about, is there a way to replicate this study at a national level as a test case?
So the report that I put on the chat, it has a chapter for each of the activities that were conducted. And I think that could be a good blueprint for what could be done at the national level. So for instance, there is a literature review that was done globally. So maybe that can just be reused at national level. Then there was the risk landscaping exercise, and that one has a specific additional report that is linked on the final report. So you can see how that I think is a good one that could be done at national level. So the report is breaking to one chapter for each of the activities that were carried out. And I think it's a nice blueprint for which activity, for reading and saying, okay, which of those activities could we do at the national level? But if there is funding for, so the study was called OHIS, the One Health Intelligence Scoping Study. And what it proposed as its main deliverable was a framework for quadripartite One Health, or for a framework for One Health intelligence. If the development of that framework is financed in the future, then it's definitely going to be one of the outputs to develop, to give a blueprint both at the international level and at the national level. So kind of like a step-by-step guide could come out of that. But for now, what I think countries can already do is go through that report and see which those activities could just be replicated at the national level.
Thank you, Fernanda. If you don't mind putting my hoof in here as well. I think it was really important as part of the OHIS study that we did take learnings from national systems and subnational systems too. And that is reflected in the report. We know that there are many countries who are much further ahead in developing One Health surveillance systems, event or indicator-based surveillance systems, and understanding the challenges they faced and their ways and means around those challenges were really informative for the OHIS, the One Health Intelligence Scoping Study report. So there's definitely a need for this bi-directional learning for the global and national and subnational level too, including regional. I could talk to you about OHIS for hours, as we have over the last 2 years. But is there any further questions to Fernanda today?
If there are no specific questions and I'm just allowed to fill in the time here, I just wanted to say something that I think kind of connects with the first talk, the platform. So we did just because I think in both talks, I think, Kat, you're right that the national and the international perspective complemented each other well today, but also in both talks, it was emphasized how we need both to understand the operational work, and the tools are kind of just a way to support that. And I was listening to the talk about the dashboard and the sharing, and then the question about whether there has been any event which was pursued jointly. So in Sweden, we tried to do something similar. We looked specific at the data we had on Campylobacter and the data we had in chickens and the data we had in humans, and whether we could have some sort of dashboard that allows us to track those things. And ultimately, data sharing barriers didn't allow us to build that kind of tool. But what we realized is that most often what we wanted was not happening at the same times anyway. So we didn't need to share what was going on in real time. What we needed was to monitor it in chickens, so that as soon as there is an alarm in chickens, we then warn the health authorities and they know that something could be coming on in humans. And ultimately then we solve that with an operational flow framework, operational workflow, rather than a tool, rather than a dashboard. And so I think some of those things came up on the scoping study, where not everything is a tool. Some of them we just need to understand what is the ultimate goal of what we're trying to do. And not always we have to fight the data sharing or the data interoperability. It's not always possible to fight them, but sometimes we can try to work despite. Those things are just going to still be in place, and we just have to understand how we do our work despite of them, or in the existence of those barriers. They are there also for a reason, and there is a security thinking behind that. So it was something that came up also in our international thinking, that data sharing was of course also a barrier, but understanding the communication workflows between people that can go around some of that was, it was documented as something to look at.
I think that's a really nice example, Fernanda, and a really good reminder that I think over the last 10 years, we've seen ICT solutions as a solution to a lot of our information sharing and challenges and improving our response mechanisms. But in reality, we need to reflect about what is needed, what is the absolute ask. Because ICT can improve our ways of working and make things quicker, but will it inform and improve our actions, and thus having impacts on human, animal, and our environmental health is a very good assessment. I will say one of the biggest learnings I took from the OHIS project and engagement was this risk mapping exercising and understanding the flow of how hazards emerge and the ultimate impacts of them, and where along that temporal chain that we can usefully implement surveillance to inform action. I think that's a really nice exercise for people to do in their priority diseases or priority actions at a national and subnational level.
Yeah, and not sorry, and just I wouldn't be preaching my gospel if I downgraded too much the role of data interoperability, because that's a lot of the work we do. But during the OHEs, we had the discussion with external partners who all discussed not necessarily the problem of data interoperability, but more, not data sharing, but more of data interoperability. So there were external partners who were saying, we really need kind of common annotation schema and not necessarily standards, but some semantic tools for how we annotate our data so that it's reusable. And they were saying we can maybe annotate our data, but the kind of political will, networking, community size that you need to develop those common annotation schema needs to come from the global organizations. So the quadripartite is at a position where they could coordinate the development of those schema, even if then ultimately everyone has to code their data. But what they were saying is that when there is a problem, and when the problem is big enough that people do agree to share data, our data just can't connect to each other, or the context of in which the data was collected is lost when you're trying to reuse it for another purpose. So I think that's also something we should take with us, not just data sharing, but also, you know, preserving the context of data, good metadata annotation. Sometimes we can't annotate data, but we can annotate metadata. And how do we do that? And what is the role and almost the responsibility of the global organizations in facilitate the kind of community building that leads to the development of those schema. I needed to pray. I needed to spread that gospel to make justice to my talk.
I think for fear that this would become the Fernanda and Kat having a chat meeting, I think I will call it to a halt. But I would just say, in terms of data annotation and schema, this is an area of significant global interest post COVID-19 pandemic in public health field to improve our way of data interoperability and similar language schema to be used. And I know that it is a topic of concern and of negotiation for the pandemic accord as well. So it will not be going away. I'm sure, Fernanda, we'll have you back in the near future to discuss what it means for zoonotic diseases as well. I don't see any more questions in the chat. So I'm going to say thank you very much, Fernanda, for that presentation today. And I know, as you can see, Fernanda's enthusiasm for OHIS and the next iterations, I know she'd be very happy to take further questions from you offline too. Silas, I think it's over to you now because I've spoken way too much. Thank you.
Thanks, Kat. No, we're happy to take over, and yeah, really wanted to echo my thanks to both presenters today for as ever some really interesting talks. So thank you for that, and thanks also to everyone for their interesting questions, and certainly no bad thing. I think the Kat and Fernanda show lots of very interesting topics. I want to first talk a bit about the next ZDAP meeting. So that is at the end of our ZDAP year, and we're looking to probably hold a final session, but an extended session in early December. And this is going to include some reflections on the year, as well as a discussion on how the ZDAP can provide the most value for its members in 2024. As ever, we're really happy to take any other suggestions or additions for that agenda at the end of the year as well. A point on ZDAP in the next year. Unfortunately, after 2 years of chairing, the UK will sadly not be able to perform this function next year, though we will still have resource to support the new chair or co-chairs as best we can. So we really would like to invite all members to consider being the chair next year, and remind you that this can be in partnership with another group member in order to minimize the requirement between yourselves. We're really happy to discuss our experiences with anyone who might be interested in taking this forward, even if that's just tentatively. You don't have to make any sort of commitment now, but we're really happy to talk about how we've done it and the expectation there as well. So we will follow up further via email after this meeting on that and the chair organisation for next year as well. The other big thing for the final meeting, if I just share my screen quickly, excellent, can everyone see that? Yes, brilliant. So we will be asking all ZDAP members to each present a version of this slide that you see on your screen at the moment with the information from your own perspectives and organizations. So this shouldn't require a lot of writing or necessarily words, but it should hopefully provide a strong overview in the different areas we've set out here. So you can see there's some conversation on primary diseases and outbreaks of concern from 2023, as well as some interventions that your organization may have taken and the impact of those, any challenges experienced in 2023, as well as, I think, of particular interest to the wider ZDAP community, this learning and successful practices, before a bit of a reflection to 2024. So looking, of course, at priority areas and any actions expected next year, and then finally some requests for ZDAP. And again, that can be quite broad. So that might be an opportunity to ask for certain topics or areas of discussion for the community in the next year, or perhaps areas where collaboration might be particularly useful, perhaps recognizing there are some very common challenges or priorities across ZDAP members in the next year. Again, we will share this slide via email with some more kind of examples from the UK side and explanations if that's helpful. So I think we're sort of asking to do this really because we think it's going to hold a value for the group. So hopefully informing and supporting better communications and coordinations between us all moving forward as the group. We've had really great opportunities, I think, to learn from experts throughout ZDAP this year, but have not managed to attain the learning and collaboration from one another, recognizing, of course, the valuable experiences and expertise held within all members of this group. So we want to progress, I think, together on this really, and understand more the different zoonotic disease contexts in each of our countries and organizations, as well as individual priorities. So we might better work with one another and support our mutual interests, or indeed tackle shared challenges. So we're hoping that this will help to identify some areas where we can collaborate with one another more. As I said, we'll send this out via email shortly, and we'll probably be asking for the returns with the details on these slides at least 10 working days in advance of the meeting. I think that is it from me, Kat. So I think it's just really a message to say I thank everyone for your attendance today and the kind of everlasting support on this and all things ZDAP, really. And really do look forward again to actually receiving your information on this slide and hearing and seeing a bit more about the kind of specific action that each of you have been taking over the last year, recognizing this is something that we all, of course, do. And particularly what kind of collaboration opportunities or considerations we might want to make in 2024. I'll just pause in case there are any questions on this. No? Superb. Any other business before we close the meeting then? No. Excellent. I think almost perfectly on time then today. I really hope you've all enjoyed the session today. I know I have, and I thought the both presentations were very, very informative. Certainly I've learned something to take away with me in my day-to-day work. I hope you all have too. And I guess without any further ado, big thanks to everyone. Have a great rest of your day wherever you are, and we will see you again very shortly.
Thank you, Silas. Thank you, everyone. Speak soon.